Before we begin, take a second and subscribe to this channel. The content you find here can truly change the way you see your body, your health, and even your future. Now, let me ask you something uncomfortable, but important. What if your body tried to warn you, and you didn't notice? Some of the deadliest diseases don't arrive loudly. They don't scream. They whisper. Pancreatic cancer is one of them. It's known as one of the most lethal cancers in the world, not because it can't be treated, but because it's often discovered too late. In its early stages, it hides. Few symptoms. Sometimes none at all. Life goes on until one day, something feels off. A strange pain. A discomfort you can't explain. Something easy to ignore. Today, I'm going to talk about a symptom almost no one associates with pancreatic cancer, yet it's more common than people realize. And I'll also explain other warning signs your body may give long before it's too late. This information could save a life. Maybe even yours. Pancreatic cancer doesn't become dangerous overnight. It begins quietly at the cellular level, when one single cell starts growing in a disorganized, uncontrolled way. The pancreas sits deep inside the body, hidden behind other organs. There's space for a tumor to grow without being noticed. And that's exactly what makes this cancer so deceptive. Unlike other diseases that cause early and obvious symptoms, pancreatic cancer is often oligosymptomatic, meaning it produces very few signs, or none at all, in the beginning. The body may feel slightly different, but nothing alarming enough to stop daily life. Another challenge is treatment. Even with modern technology and minimally invasive techniques, pancreatic surgery remains complex and risky. Accessing the organ is difficult, and complications are common. But the biggest problem isn't the surgery itself. It's timing. Most people only discover pancreatic cancer when it has already reached an advanced stage, when symptoms finally become impossible to ignore. And that delay can change everything. One of the most overlooked warning signs of pancreatic cancer is pain, but not the kind people usually worry about. It often starts as a strange discomfort in the back. A deep, dull pain. No clear injury. No radiation down the legs. Nothing that feels like a spine problem. I'm sharing this because of a real case. A patient once came in complaining of persistent back pain. It didn't behave like a typical orthopedic issue. Something felt off. Imaging exams were ordered, almost as a precaution. The result was unexpected: pancreatic cancer. Thankfully, in this case, it wasn't in an advanced stage. The patient sought help early, simply because that pain felt unusual enough not to ignore. Many others aren't as fortunate. Looking back, patients often say, "It started with a strange back pain, then an odd abdominal discomfort, but I didn't think it was serious." And by the time they do, the disease has already progressed. Another common and deeply underestimated sign is unintentional weight loss. This isn't the kind of weight loss that comes from dieting or lifestyle changes. It happens quietly, slowly, and without effort. In pancreatic cancer, the body begins to lose weight because digestion no longer works the way it should. The pancreas stops producing enough enzymes to properly absorb nutrients, especially fats. Even when a person eats normally, the body is no longer getting what it needs. At the same time, the tumor itself consumes energy and creates a constant inflammatory state. Muscle mass begins to fade. Strength declines. Clothes feel looser. Appetite may decrease, or fullness comes too quickly. Many people explain it away: "I'm just getting older. My metabolism must have changed." But when weight loss continues without a clear reason, especially when paired with fatigue or digestive discomfort. It's not normal aging. It's a signal, and signals like this should never be ignored. Subtle digestive changes are another warning sign that often goes unnoticed. Stools may become lighter in color, oily, foul-smelling, or start floating in the toilet. These changes happen when fats are no longer being properly digested, something that depends directly on a healthy pancreas. Because this doesn't cause immediate pain, many people feel embarrassed to mention it or assume it's something temporary. They blame stress, food choices, or minor digestive issues. But the intestine often becomes the first place where the body quietly reveals that something deeper isn't working. Along with these changes, people may notice bloating, excessive gas, or a constant feeling that digestion is off, even after light meals. Individually, these symptoms seem harmless. Together, especially when they persist for weeks or months, they form a pattern. And the body rarely speaks in a single loud symptom. It whispers through repetition. Another silent but powerful warning sign is the sudden appearance of diabetes after the age of 45 or 50, especially in people with no previous history. In many cases, pancreatic cancer interferes directly with insulin production or creates inflammation that makes the body resistant to it. When blood sugar rises quickly and becomes difficult to control, even with treatment, it deserves deeper investigation. There may also be subtle yellowing of the eyes or skin. Not dramatic at first, just a slight change. Urine may darken. Stools may become paler. It happens slowly as a growing tumor begins to partially block bile flow. And then there's the fatigue. Not ordinary tiredness, but a deep exhaustion that doesn't improve with rest. A heavy body, a foggy mind, a constant lack of energy that feels out of proportion to daily life. These changes don't scream. They quietly accumulate. What makes pancreatic cancer especially dangerous is not just how aggressive it is, but how easily its early signals are dismissed. Many people wait for intense pain before seeking help. Culturally, discomfort is often normalized, especially with age. Back pain is blamed on posture. Digestive changes are blamed on diet. Fatigue is blamed on stress or getting older. But pancreatic cancer rarely announces itself with one dramatic symptom. It speaks through patterns. A persistent discomfort that never fully goes away. Weight loss combined with digestive changes. New diabetes paired with unexplained fatigue. The body doesn't usually warn once. It repeats itself quietly. If symptoms last weeks or months, especially when they appear together, ignoring them costs time. And with pancreatic cancer, time is the most valuable thing you can lose. Listening early is not fear. It's awareness. Your body is not fragile. It is intelligent. Long before disease becomes visible, it whispers. The tragedy is not that pancreatic cancer is silent. It's that we've learned to ignore silence. A strange pain, a subtle change, a discomfort that doesn't belong. None of these should be dismissed as nothing, especially when they persist. Early attention doesn't create fear. It creates options. It creates time. And sometimes, time is the difference between treatment and regret. So here's the question that matters. What signal has your body been sending lately that you've been choosing not to hear? If this message helped you see your health differently, leave a comment below. Your experience may help someone else recognize a sign they've been ignoring. And if you're not subscribed yet, subscribe now and stay with the channel. More videos are waiting on your screen. One of them might be exactly what you need to hear next.